Some very nice person just stopped by to make sure I'm doing okay, and I'm doing great. Just chilling. But it's nice to know that there's someone near here with, an indoors and a power outlet in the event I need it. So, moving on, the CDC urges reopening of schools. Here's the blueprint. The Centers for Disease Control and Prevention on Friday urged that K-12 schools be reopened as soon as possible, and it offered a step-by-step plan to get students back in classrooms and to resolve a debate dividing communities across the nation. The guidelines highlight growing evidence that schools can open safely if they use measures designed to slow the coronavirus's spread. The agency said that even in communities with high transmission rates, elementary school students may receive at least some in-person instruction safely. Now, let's just take a moment to hope that this is also being looked across the lines of equity and maybe those disenfranchised communities that probably aren't being considered as much as they need to be for both the vaccine rollout and reopening of schools, because we all know that all schools are treated equally with funding. Anyway, middle and high school students, the agency said, may attend in-person classes safely when the virus is less prevalent, but may need to switch to hybrid or remote learning in communities experiencing intense outbreaks. Again, see racial lines. Quote, CDC's operational strategy is grounded in science and the best available evidence, Dr. Rochelle Walensky, director of the CDC, said Friday in a call with reporters. The guidelines arrive amid an intensifying debate. Even as parents in some districts grow frustrated with shuttered schools, some teachers and their unions refuse to return to classrooms they regard as unsafe. Public school enrollment has declined in many districts. Education and civil rights leaders are worried about the harm to children who have not been in classrooms for nearly a year. And regardless of my prior commentary, the fact that children are out of school for a year is terrifying from the point of view of their social development. I would not be doing well if I was still in school, and yet not. Fortunately, there's no snow day today. It's every day is a snow day, essentially. So, the recommendations tread a middle ground between those eager to see a resumption of in-person learning and those fearful schools reopening and those fearful that schools reopening will spread the virus. In advice that may disappoint some teachers, the document states that vaccinating educators, see School A7, schools from A1, should be a priority but not a prerequisite for opening schools. Still, both national unions thanked the CDC for the clearer guidance. Quote, for the first time since the start of this pandemic, we have a rigorous roadmap based on science that our members can use to fight for a safe reopening, said Randy Weingarten, president of the American Federation of Teachers and an ally of President Joe Biden. But Weingarten and Becky Pringle, president of the National Education Association, argued that schools might find the CDC's mitigation strategies difficult to enact without additional federal funding. Again, funding equity. Important. The agency's guidance repeats the idea that schools should be the last to close and the first to reopen in any community. But the CDC has no power to force communities to take steps to decrease the high transmission rates, such as closing non-essential businesses, in order to reopen schools. Left hand's not talking to the right hand. We've seen a lot of that so far. More than 90% of U.S. counties are seeing viral transmission rates at which the agency advises against fully in-person instruction, Walensky noted. Nonetheless, the majority of districts are offering at least some in-person learning, and about half of the nation's students are learning in classrooms. But there are disparities in who has access to in-person instruction, with urban districts serving mostly poor, non-white children more likely to have closed schools than suburban and rural ones. Researchers are concerned not just about the academic consequences of being out of school for such a prolonged period. While data is limited, many doctors and mental health experts report seeing unusually high numbers of children and adolescents who are depressed, anxious, or experiencing other mental health issues. Let's also not avoid the fact that adults are also suffering from the same. Destigmatize mental health issues, people. This is the time to do it. The CDC offered advice to school administrators tailored to 4 levels of viral transmission in the surrounding communities. The agency said that elementary schools could remain open regardless of virus levels in the surrounding community, pointing to evidence that young students are least likely to be infected or to spread the pathogen. Only in communities with the highest transmission levels should elementary schools switch to a hybrid model, with some remote instruction and some in-person instruction, the agency said. In any scenario, elementary schools should remain at least partly open. Middle schools and high schools should close completely and switch to virtual learning when transmission levels are highest, the agency said. Quick side note, it would be nice if they actually printed what those levels are in here, so we would know. The guidelines also prioritized in-person instruction over extracurricular activities like sports and school events. In an outbreak, these activities should be curtailed before classrooms are closed, officials said. Some experts raised concerns about the strategy. Many schools in communities where viral transmission is high have been open for fully in-person instruction without experiencing outbreaks of the virus. Here's a photo of a school and a family at Blair Early Childhood Center in Chicago, though. Absent from the agency's guidance were detailed recommendations on improving ventilation in schools, an important safeguard, and I believe that was the first thing that was brought up, besides distancing the desks. In one short paragraph, the CDC suggested that schools open windows and doors to increase circulation, but said they should not be open if doing so poses a safety risk or a health risk. Okay, let's just take a little moment to look back outside. Okay, this is Seattle. That's Chicago. I imagine that the windows and doors being open might not go as far as they want. The CDC gives lip service to ventilation in its report, and you have to search to find it, said Joseph Allen, an expert on building safety at the Harvard T.H. Chan School of Public Health in Boston. It's not as prominent as it should be. Other preventative measures the CDC recommended for schools are those it has previously endorsed. Universal wearing of masks and physical distancing are the most effective, but the agency also endorsed hand washing and hygiene, cleaning, and contact tracing. We've seen all of that. It doesn't look like it's particularly mentioning double masking, which I think still has to make its way into a lot of the media cycle literature, besides just being yet another update from the CDC. The CDC said that in communities with higher levels of transmission, schools should make sure individuals maintain at least 6 feet of physical distance. But in communities with lower levels of transmission, the agency said that students and staff should be physically distanced only, quote, to the greatest extent possible. Helpful. Quote, we're worried that people will not be able to get back to full in-person learning if we mandate 6 feet of physical distance, Walensky acknowledged. As it had previously, the CDC recommended using 2 measures to determine the risk of transmission in the community: the total number of new cases per 100,000 people and the percentage of positive test results over the previous 7 days. Dr. Helen Jenkins, an infectious disease expert at Boston University, said the percentage of positive tests can vary with how much testing a community is doing, and the highest levels of community spread defined by the agency are too conservative. Schools would be safe even if there were more cases in the community, she and other experts said. The guidance was issued as Biden faces increasing pressure to deliver on his promise to get the majority of K-8 schools back to in-person teaching by the end of his first 100 days in office. And again, will be fascinating to see what the racial equity breakdown is and the economic equity breakdown is of the schools that do get there. He acknowledged the goal was ambitious, but added, quote, it is also a goal we can meet if we follow the science. Biden said schools will need more money to meet the CDC standards and called on Congress to pass his coronavirus relief package quickly to get $130 billion in aid to schools. Quote, we have sacrificed so much in the last year, Biden said in a statement on Friday. Quote, but science tells us that if we support our children, educators, and communities with the resources they need, we can get kids back to school safely in more parts of the country sooner. If the new recommendations had been in place last fall, San Francisco could have opened all of its schools for fully in-person instruction in mid-September. Today, according to the guidelines, San Francisco could open elementary schools in a hybrid mode, and the city is close to being able to open middle schools and high schools in a hybrid mode. Instead, the city's schools have been shuttered since the pandemic began, and the district has agreed to far more restrictive reopening standards with its union. Officials have set no date for bringing young children back to school and have said they do not expect most middle and high school students to return in person this year. The new guidance recommended that states immunize teachers in early phases of the rollout, but said access to vaccines should, quote, nevertheless not be considered a condition for reopening schools for in-person instruction. Vaccinating teachers is very effective at reducing cases among teachers and students in a model of transmission in high schools, said Carl Bergstrom, an infectious disease expert at the University of Washington. Quote, it should be an absolute priority, he said. Still, he added, quote, I can certainly see why they chose not to make it a prerequisite, because it may not be something that can be done in time to have schools open.